Good evening. Good evening. Site for model exam, asked site for model exam. Many time I have posted in the group. Just go and check in group. Asked site for model exam. Many time I have posted in the group. Just go and check in group. You can see our new website. I have already discussed that we have started a new website. But you people are just before exam. You are trying. Before exam. More than 3 to 4 months we are with the new website, and you people are not doing. So okay, we'll start the class. We'll start the class. 1 minute. Yesterday we have conducted one model exam. One model exam we have conducted, and only few students attended the main exam. Only few students attended the main exam. I mean the Aiims model exam. Other people, they attended a practice test because they have some duty, so they couldn't do within the time limit. So if you cannot attend the class within the time limit, then don't worry. You can attend the practice or model exam is that you can attend that thing. Okay. We'll start the class within 1 minute. Many people told me that after duty they are not getting time for studying all those things. See, I am doing all those things after my duty. Like you, I am also doing the duty. I am working in a hospital. So like you, I am also working in a hospital. We also have the COVID patients, COVID duty, all those things. But after that, I am also preparing, or I am also taking class. See, you know that the duty of a coaching center, why you people joined this coaching center means our duty is to reduce your workload, your effort, so that when you suppose if you are studying or if you are preparing by yourself, it may take 5 hours to study one topic or one subject or whatever it is, but that thing within 1 hour you can study when you study with us, or when you study in any coaching center. So those coaching center who are doing this work, that coaching centers are better and they are doing their duty. So coaching center duty or coaching crash course, all those things. Okay, the function is that reduce your effort. So after your COVID duty or hospital duty, it is very difficult. It is very difficult you people to go and open the book and refer and find out the important points. That's why you people are joining course. So see, now almost 9 to 10 days are there in front of us. Do it. Many students after attending exam, I have sent the rank list. Only few people attend the main live test. In live test rank only I can send. If you attend in practice test, I will not attend, because I will not send, because practice test you can attend any time, 10 time, 100 time you can do with that one. But a live test, Aims model exam, only one time you can do. So I will send the rank list. So in that rank list, if you see those people who scored good score, the first one, second one, these people continuously they are doing preparation, or continuously they are practicing test series. And other students who just joined, or those people who got less mark, understand what is your level. So with this level, if you are going to attend Aims exam, I'm sure, damn sure, you will not get any good rank, or you don't hope for a job, because 50% is the passing mark for Aims. If you get 50%, it doesn't mean that you will get job. If you get 50%, okay, you are eligible. But after that, as per your rank, your score only, they will select you. So if you are going with this level, you will not get the job. Don't worry, you have enough time. That's why you joined coaching, and it's a last time preparation. So in the last time preparation, what you have to do? Study the important points, important topics, then use some tips. I told you tips regarding tips, elimination method, that is a tip I told you. So use that elimination method tips, and try to answer maximum questions. And you have to also eliminate. Before answering, eliminate. Also, if you cannot eliminate any option, leave that question, because negative mark is there. That class link I will give you again, so that those people who didn't attend that class, they can watch it. I will give you that link. Okay, so we will continue today also fundamental of nursing. Today is the last day for the fundamental of nursing, and coming 3 days it will be medical surgical discussion. Don't worry if you get if you get a score, very less score. Don't worry, because you didn't prepare. If you get less score, means it doesn't mean that you are a fool, or you are not a genius, or if you are not a good student. Simply you are not preparing well. That's the problem. If you prepare well, definitely you will get a definitely you will get a good score, good rank. Those people who are getting good rank, they are preparing for the last 2 3 months or 5 months or 6 months. Okay, so if you do it in a proper manner, definitely you will also able to do that. So do it, do properly, do your study properly. 3 month, 4 month, whatever it is, do it properly. And after that also, if you are not getting selection, means then you make sure that, okay, this job is not for you, you try for some other thing. I'm not telling you to every 1 year, 2 year, 3 year you will be behind aims. No, if you cannot do it in 1 year, after preparing well also, if you are not getting selection, means don't think about it. Okay, 1 minute, I will just I'll take 1 minute just to arrange the slide. After that we can start. Hope all you can hear me properly. Am I audible? My sound is okay? You can see me? Okay, you people can see me. If you, after some time, if you can see my slide, just tell me. If you can see my slide, just tell me. Can you see the slide? Slide, can you see slide? Okay, slide you cannot see. Okay. Can you see the slide now? Slide you cannot see, no? Cannot see the slide. Okay, wait. Just one minute. I think now you can see the slide. Okay. Okay. So we will start from today's class. We discussed. I hope you people just I told you that no need to study further. Study further means don't spend in the same thing. Yesterday we finished a 2 hour class. Today also we will study fundamental of nursing 2 hour. Then what you have to do? You have to practice the test. Practice the test, and after I see when you attend the Aims model exam. Once you attend Aims model exam, next day I will tell you the score, rank. Okay. Then after that, you can see in the website Aims model exam, practice exam. So click on that practice exam and attend 1 or 2 questions, then submit, then view the answer. So if you want to view the answer of the Aims model exam, what you have to do? Next day I will post Aims model exam, practice exam. In that exam you can see the answer. Okay, so just attend that practice exam, maybe 1 or 2 question you attend, then submit, then check the solution, so answer, so you can see all the answer. So check it, review it. If you are just attending exam, no use. You will just attend exam, you will get 20 mark, 30 mark, but after that you have to refer. I mean, you have to check what was the correct answer, what was the wrong answer, all those things you have to check it. Okay. So by discussing these questions, we almost discussed the important topics. Rest of the topics we will discuss today. We discussed the theories. Okay. Apart from this, what you have to do? Uh, I have sent you the important study material. From that, biomedical waste management. Then the cylinder, for some cylinder there is a color code for the cylinder. Then important positions used in different procedure. Then so position, then color code for the cylinder, biomedical waste management, then cannula size and color, then important um, important values I have given. Lab values, important lab values I have given. So please study that thing. Okay, I am not going to discuss here because no need to waste our time. That thing you can read from the study material itself. Study material is available in the website. Okay. Yesterday we have, okay, from here we will start. Okay, this is the question. In a blood pressure recording, it is 110/80 millimeter of mercury. The pulse pressure is, what is the pulse pressure? Okay. So pulse pressure, all of you know that pulse pressure. What is the pulse pressure? Difference between systolic and diastolic pressure. Difference between systolic pressure and diastolic pressure. Simple question. So the answer will be what? The answer will be 30. Simple question. 30. Okay. If you don't know this, it means that you don't know the basic thing. So don't go for the exam. See, we all know how to take blood pressure. We know all those things, but pulse pressure, all those things, it is not in the practical thing. So so if you don't know this thing, this theory, so don't go for the exam. Maybe you are a good nurse, you know how to do, know how to check BP, how to do assist operation, how to do IV cannula, all those things. But if you don't know theory, this type of theory, so no use, you will not get job in Aims. So you need theory plus practical. Okay, so this is simple. Pulse pressure means systolic, difference between systolic pressure then diastolic pressure. So this pulse pressure will be widened. Widened pulse pressure can be seen. Widened pulse pressure. Widened. Maybe you cannot see that. I will change it. Widened pulse pressure can be seen in where? One question. Widened pulse pressure can be seen in. Widened pulse pressure can be seen in. This is pulse pressure. You know, this is a pulse pressure. I know. Okay, this is pulse pressure. Okay, so in some place the pulse pressure will be widened. Okay, you can see pulse pressure is increased like a 60, 80, something like that. So widened pulse pressure can be seen in, Nirmala told the correct answer, ICP. Very basic question, simple and basic question, this one. Okay, these questions they are not asking now because they asked in many exam. Many exam they have asked, so they are not asking. So in increased ICP, you can see widened pulse pressure. Nowadays they are not asking these questions. Okay. Blood pressure is controlled by. Blood pressure is controlled by. Next question. Blood pressure is controlled by thyroid gland, thymus gland, adrenal gland, corpus luteum. So blood pressure, you know that blood pressure, lot of systems are controlling our blood pressure. Lot of system is contributing in our blood pressure. If you see our autonomic nervous system, brain, all the lot of things are there. So among these options, from these options, what you will select? From these options, what you will select? Okay, there are other, your autonomic nervous system, all things are affecting your blood pressure. So from these point I am asking, from this point, it is adrenal gland. Okay, adrenal gland. Okay, adrenal gland, because you know renin angiotensin, all these mechanism, all these mechanisms. Okay, these are one of the important part in the blood pressure. So renin angiotensin is related to adrenal gland. So adrenal gland. Okay, so from these option they have asked. So from these option it is adrenal gland. Next coming pain scale. Pain scale used for assessment of pain in post-operative patient. Pain scale used for assessment of pain in post-operative patient. So different pain scale we are using. So in image-based question, I will explain about some pain scale. There are different pain scales are there. Single dimensional scale, multiple dimensional scale. There are different scale. I'm not going into detail, but I will tell you some important scales. Okay, that is coming under single dimensional scale. Okay, one is visual analog scale, VAS, visual analog scale, then numerical rating scale, then verbal descriptor scale, verbal descriptor scale, VDS, numerical rating scale, NRS, visual analog scale, VAS. Okay, you don't no need to study. Lot of scales are there, but at least study these three: visual analog scale, numerical rating scale, verbal descriptor scale. Okay, this is visual analog scale. This is visual analog scale. Okay, so sometime you in image based question they will give you. So what is this? So it is a visual analog scale. Like in that you can see that here this is the point one starting point. This is the last point. Okay, maximum point. So we will tell this is a 10 centimeter, 10 centimeter like this is a 10 centimeter line, 10 centimeter line, and we will tell the patient to mark where is your pain. Okay, mark in this line as per your pain severity. So patient may tell here or may tell here, may tell here. Okay, so this is visual analog scale, visual analog scale, short form VAS, VAS, VAS. Okay, this is verbal descriptive scale, VDS, verbal descriptive scale, verbal descriptive scale. Okay, in this scale, description has given. This is no pain, mild pain, moderate, severe, very severe, worst, like that. Okay, so here description is there. You can see the description. They have described about the pain. Description is there. So that is why verbal descriptive scale. Okay. Then numerical rating scale. Numerical means number. Numerical means number. See, number is there. Numerical number. They will tell you 0 to 10. Please rate between 0 to 10. That is numerical rating scale. Then this scale is, you can see in sometime you can see in image based question. This is Wong-Baker faces pain scale. Wong-Baker faces pain scale. Remember the name Wong-Baker faces pain scale. Sometime you will get this picture and they will ask you. So you have to tell that this is a Wong, starting with the W. Wong-Baker faces, Baker. Remember the name Baker. Okay. Faces, face is there. Faces pain scale. Mainly we will use this in children, because children cannot explain all those things. So mainly we will use in children, and also in patient who cannot speak, dumb patient. Okay, dumb patient, all those things you can use. Children and dumb patients. Okay, this Wong-Baker faces pain scale. So here total how many points are there? Sometimes they will ask how many points. 1 point, 1, 2, 3, 4, 5, 6. Total 6 point is there, starting from 0 to 10. Sorry, 0 to 5. Starting from 0 to 5. Like 0, 1, 2, 3, 4, 5. Okay. So 5 faces. Sorry, 6 faces you can see. This is a 0 face, a 0. This the score is 0 only. Okay, but this is the first face. So you can see 1, 2, 3, 4, 5, 6 face you can see. 6 face you can see. Okay. So, but the total score will come 10. Total score will come 10. Okay. Wong-Baker pain scale. How many face you can see? 6 face you can see. 6 picture you can see. Remember, 6 picture you can see. But the starting picture score is 0. The starting picture score is 0. Okay. So, what will be the answer for this question? Pain scale used for the assessment of pain in post-operative patient. So I don't know this type. What is this type of scale? VAP, AVP, VSP. I don't know. I don't know if this type of pain scale is there or not. I don't know. But The answer is VAS, Visual Analog Scale. VAS, Visual Analog Scale. These scales. I don't know. There is scale in this name. I don't know. Okay. So just I eliminated. So the answer is VAS. Next. Which of the following is used for assessing the pain in children? Pain in children, which scale we will use? Just now we discussed, what was that? Wong Baker faces pain rating scale. Okay. Next, first action that the nurse should take if she finds the client has an O2 saturation 68%. See, lot of questions you can see like this. Means there related to nursing intervention. You can see lot of questions. This is a simple question, but you can see this type of question. So if you don't know the if you are not that much clear about the theory, then also these type of questions, if you read, you can answer. So whenever you see this type of question means regarding prioritization, what you will do first. Okay, prioritization, priority, first action. They will ask what as a nurse, what will be your first action? First, what you will do? First action or last action? First action or last action? Like this, lot of questions. You will see this one. You will see. Forget this question. I am talking about the prioritization. So you can see a lot of questions regarding nursing intervention. In that, they are asking priority, or sometimes they didn't ask priority. They will tell what you will do. Okay, so what you have to do means always you follow ABC. ABC. What is A? A for airway, B for breathing, C for circulation. Okay, so from among the options, you check the option. You first check the option, and from the option you see that if anything they have given regarding airway, so you have to give the answer for the airway. And breathing. If the thing is regarding airway, then if there is a breathing, some option is related to breathing, then give breathing. If there is no airway option, there is no breathing option. If there is something related to circulation, then give circulation. So it means that easily you can score these type of questions. Easily you can score means if you didn't study anatomy, physiology, fundamental of nursing thoroughly, but without studying also, by using some common sense, you can answer some questions. And these are the some of the questions you can answer by using your common sense, by using your existing knowledge, because you are working in a hospital. So that you can use that experience to answer these type of things. So what will be that? So here they have asked first action. So I told you before, forget this question. If any question related to nursing action or priority, check ABC. Check ABC: airway, breathing, circulation. So any option which is starting with the airway, give that airway answer. But remember, you have to read the question properly. Maybe the question is not that much regarding serious or something serious. Example: patient is having dog bite. Patient had dog bite. What will be your first action? So in dog bite, just if patient had a dog bite on his leg, so here airway is not important, breathing is not important, you can go for circulation. Okay, so if they are giving airway option, don't put airway option, because airway is not important in if dog is biting on a leg, means nothing will happen for airway. So in that situation, forget airway and breathing, like that. Okay, so that is why I told you, use your common sense. Check the condition, what is the condition, then check the option. If the condition is related to airway, breathing, circulation, if airway is important for that condition, and in the option there is airway, then give answer option airway. Okay, so I will give example. One example is the first action that the nurse should take if she finds the client has a O2 saturation 68%. So we know that here SpO2, oxygen saturation is very, very less. So the first action, okay, the nurse should take first action they have asked. First, what you will do? So here the condition is related to your oxygen saturation, and oxygen saturation is very, very less. So we know that, okay, I will go for the ABC. ABC. Here airway, breathing, all airway, breathing, circulation, all are related with this condition, because oxygen saturation is less means definitely I have to check the airway. Definitely I have to check the airway. But in the option, from the option when I check, I saw that one option is elevate the head. Elevate the head. Second is recheck O2 saturation in 30 minutes. Then apply oxygen mask. Assess heart rate. You can do all these for a person whose oxygen saturation is very less. But first what you have to do? First you have to give oxygen, means airway, regarding airway, no option given here. Next is B, breathing. Regarding breathing they have given one option. What is that option? Apply oxygen mask. So you have to apply oxygen mask. That is the first priority. First priority you have to do. Okay, then like that one question will come, like you find one person unresponsive, unresponsive unconscious. You find one person unresponsive, unconscious, or you witnessed in front of one person collapsed, or whatever, something happened. So what will be your first action? No pulse, nothing. Okay, like that patient unresponsive, unconscious. So before, what is your first action? So somebody will tell that check the carotid pulse, check the carotid pulse, all those things they will tell. No, first action you have to call for emergency help. Call emergency help. After that, okay, one person find unresponsive, unconscious, or one person collapsed, whatever it is, first action is call for help. After that, what you have to do? You have to check the carotid pulse. After checking carotid pulse, if there is no pulse or something, you can start CPR. So this type of question also will come. Then, recommended compression ventilation ratio for performing CPR in children. So some people, when they see CPR in children, they will stop reading, then they will check the option. Don't do like that. Recommended compression ventilation ratio performing CPR in children when there is single rescuer. When there is single rescuer. Okay, when there is single rescuer. So when there is single rescuer, what will be the ratio? 30 is to 2. Single rescuer. Single rescuer 30 is to 2. If there is double means 2 rescuer is there. If there is 2 rescuer, what will be the ratio? I am talking about children or infant. If there is 2 people, what will be the ratio? 15 is to 2. Some people sometimes they will write 15 is to 1. This is wrong. No. Answer is 15 is to 2. When there is 2 people, when there is 1 person, the answer is 13 is to 2. 13 is to 2. Okay, now we will discuss something regarding CPR. CPR, this is regarding adult. Okay, I'm talking about adult. I'm talking about adult. Okay, in adult, if it is 1 person or 2 rescuer, one rescuer, 1 nurse or 2 nurse, whatever it is, your ratio is 30 is to 2. What is the ratio? 30 is to 2. 30 is to 2 in adult, 1 person or 2 person. Remember yesterday I told you, now we are studying. Now we are studying. Don't think that, okay, now I will watch the class. After that, I will take the book and I will study. No more time for that. Now itself study. For adult, 30 is to 2, 1 rescuer or 2 rescuer. Okay. Hope you all know what is CPR, In CPR there will be 1 or 2 people. Okay, because you are working in hospital, so you are familiar and you are doing all those things. I know you are expert in doing CPR, but we have to know all these things. Okay, then chest compression. What will be the chest compression rate? 100 to 120 per minute. Okay, you will press the chest, no? You will press the chest. Chest compression you will give. Chest compression you will give. So the chest compression rate I am telling 100 to 120 per minute. 100 to 120 per minute. Per minute important. 100 to 120 per is important. And one more thing, at a rate. At a rate. See, at a rate. They told at a rate. Okay, because in exam they will give you option like approximately. Okay, so you will get confused. Approximately or at a rate. Approximately or at a rate. You will get confused. Now itself at a rate. Definitely you have to give. Approximately means you can give. Approximately you can give like that. No, before it was approximately. Now at a rate 100 to 120 you have to give. Okay, then compression. When you compress the chest, okay, how much or how many centimeter you will compress? At least 5 centimeter. Here also at least 5 centimeter. I am talking about adult. So 3 points, 3 is to 1, 3 is to 2, 100 to 1, at a rate 100 to 120, then compress 5 centimeter, at least 5 centimeter. Then one more thing, you will give breath also. So the breathing rate in CPR, breathing rate 10 to 12 breaths per minute. 10 to 12 breaths per minute. 10 to 12 breaths per minute. Okay, in CPR you are giving breathing, no? 30 is to 2, 30 is to 2, 30 is to 2, like that. So, at least 10 to 12 breaths per minute. If they are asking in second, how many breath you will give me if second they are asking, you have to tell 1 breath every 5 to 6 seconds. 1 breath every 5 to 6 seconds. If they are asking in minute, 10 to 12 breath. You can take a screenshot. Later you can refer, because these things you may forget. These are the numbers you may forget. So take a screenshot so that before exam you can just refer. 1 breath every 5 to seconds. 10 to 12 breaths per minute. Then this next is a common question. Head tilt, chin left. You know, before giving CPR, we have to open the airway, no? Open the airway. So how you will open the airway? By using head tilt, chin lift. Head tilt, chin lift. If there is head or neck injury, if there is a trauma, head injury or neck injury, we cannot use this head tilt, chin lift. So what we will do? We will use jaw thrust. We will use jaw thrust method. Jaw thrust method. Now I'll discuss regarding child and infant. In child and infant, we will give 30 is to 2 if there is one rescuer, one person. If there is 2 people, we will give 15 is to 2 for 2 people. Child and infant. Okay. Then chest compression. Chest compression about 4 centimeter. Chest compression about 4 centimeter for infant. For infant, about 4 centimeter. For adult, how much? For adult, compression. For adult, how much? Please comment. 5 centimeter. At least 5 centimeter, or at least 5 centimeter. But that is very important. At least 5 centimeter. All are commenting 5 centimeter, correct, but at least 5 centimeter. For infant, it is about 4 centimeter. About 4 centimeter. And for child also 5 centimeter, but it is about 5 centimeter. Okay. So about 5 centimeter for child, at least 5 centimeter for adult, and about 4 centimeter for infant. And when you press, you will press 1/3 of anterior posterior diameter, 1/3 of the anterior. So if this is the child, you know this anterior and posterior. Okay, anterior and posterior diameter, anterior posterior diameter. Okay, so 1/3 of the anterior posterior diameter, 1/3 of the anterior posterior diameter we will do. And in children, you have to give more breaths. In children, we have to give more breath, 10, 12 to 20 breaths per minute, 12 to 20 breaths per minute. In second, in one breath every 3 to 5 seconds. Don't get confused. Not I'm telling 3 to 5 breath in 1 second. I'm telling one breath in 3 to 5 seconds, or 12 to 20 breaths per minute. See, okay, one breath in 3 to 5 seconds, or 12 to 20 breaths per minute. When it comes to adult, one breath every 5 to 6 seconds, or 10 to 12 breaths per minute. These are simple questions. Repeatedly they may ask. So if these questions are coming, definitely you have to answer. Definitely you have to answer, because we have to get 50%, because just to get the eligibility 50% we needed. So don't think that I need 50. No, you have to score 50, more than 50%, 60 or 70%. If you can score, you can hope for the 70%. If you can score, definitely you can hope your rank in the rank list. Okay, so 60, at least 60% we have to get, at least 60%. Depends upon the exam. Anyway, it depends upon the exam, but in some exam 56%, those who got 56% also got job. 60% got, those who got, they also got job. So we have now 9 to 10 days is there. Our effort is to get that 50% or 60%. Maximum, not 50%, 60%. Please try for that. Please try for that. Practice maximum exam. Practice maximum exam. When you practice maximum exam, what you have to do? When you practice maximum exam, what you have to do? You have to just, repeat the exam, repeat the question again, repeat the question again. Means one you will attend the exam one time, you will attend the exam one time. After that, you will review that questions and answer, and attend that exam again, so that these questions will be in your mind. Otherwise, you may attend 10, 20, 30 exams, but if you don't know the correct answer, no use. It is wasting of your time. Next, mean arterial pressure is calculated as. Mean arterial pressure is calculated as. Mean arterial pressure is calculated as. See, what is mean arterial pressure means? During a cardiac cycle, the average artery pressure, that is called as mean. Mean means average. Mean means average. So in a cardiac cycle, there will be a pressure in the artery. There will be pressure in the artery. Means maybe first the pressure will be less, maybe in between it will increase. So different pressure, different time, different pressure will be there. But in a cardiac cycle, average pressure in the artery, average mean arterial pressure, that is called as mean arterial pressure. So what is the formula? So there are different formula. One formula, sometimes this type of formula you can see. One formula is cardiac output into, means multiplied by vascular resistance, systemic vascular resistance, SVR. SVR means systemic vascular resistance, plus CVP, So this is the formula. Mean arterial, one formula, I'm telling one formula. Mean arterial pressure equal to cardiac output plus, multiplied by systemic vascular resistance whole divided, whole, see the bracket, a whole bracket, okay, it is whole bracket. They are in a whole bracket. So remember this bracket plus CVP. Sometime, actually the CVP is always considered as a C. CVP is always considered as a 0. CP always considered as a 0. So no need to put the CVP here. So this also, this formula also correct. Cardiac output multiplied by systemic vascular resistance, because CVP always 0. So no need to put CVP. Okay, if in the option, if there is no CVP, also it is correct. And another calculation or formula is systemic blood pressure, SBP. What is S? S, systemic blood pressure. Okay, plus 2 diastolic blood pressure. Systemic blood pressure plus 2. I can put 1 systemic blood pressure plus 2 diastolic blood pressure divided by 3. So 1 plus 2 divided by 3. Like that you can remember. 1, 2, 3. What is 1? Systemic. That also you have to remember. Sometimes they will give you 2 dBp plus SBP divided by 3. Like that, if they are giving also, it is correct. Okay, so 1 systemic blood pressure, 2 diastolic blood pressure divided by 3. 1, 2, 3. Like that you can remember. But remember, what is 1? Systemic blood pressure is 1. But there is 2 diastolic blood pressure. To avoid pulling the urinary catheter, nurse should tape the catheter on patients. Okay, to a simple question, many times they have asked, still some people they make mistake. Okay, still some people may make mistake. The answer is upper thigh. What is the answer? Upper thigh. Upper thigh. See, any exam, if you go for any exam, suppose 100 questions, actually there is 200 questions, but 100 questions, take it 100 questions. If you are doing a normal preparation, you can see that, or in any exam, you can see that 30 to 40 questions. If 100 question is there, I'm talking about 100 questions. 30 to 40 questions will be easy question. Easy question. 30 to 40 will be easy question. Your target, your aim is to correct all these 30 to 40. Your target is correct all these 30 to 40 questions. So you will get 30 to 40 mark. Okay. If you are doing a normal preparation, I'm telling normal preparation. Simply, if you are going for exam, you cannot do it. So maybe after attending exam, now you know, some people they have attended the exam, some people attend practical exam, practice exam. So those people who attended a real exam, their score only I published. So you know that your level, what is your level? Maybe you didn't prepare well properly, or maybe you attended only 30, 40 questions, then you just skipped all those things. Maybe like that. Maybe you didn't do seriously. But there are people who are doing seriously, they are attending exam. Seriously, like an exam they are attending. They are getting 70%, 80%, all those things. So in any exam, 30 to 40 questions will be very easy. You take any exam, except some exam. Majority exam, you can see 30 to 40 questions, simple question, easy question. Your first aim is to answer these 30 to 40 questions. Next, again 30 to 40 question will be medium tough. Medium means, or medium tough, I can say medium tough, for a person who is who is doing a preparation. I'm telling, who is doing a preparation. Preparation means, see, some people they are telling, I'm doing preparation, but I am not getting. It means that you are doing preparation, you are studying something, you are studying in a detailed manner. You are, suppose if you are studying regarding heart or cardiac cycle, you are going into the deep something you are studying. I'm not telling that type of study if you have that type of memory power to remember all those things, then definitely it will help you. Otherwise, for a general people who are doing study every day 1 hour or 2 hour, who are going for regular duty, after coming duty they are studying 1 hour 2 hour, for those people I'm telling, they will get 30, they will see 30 to 40 questions like medium questions means they will think that okay, they when they read the question they see okay, one first option, second, third and fourth option, so they know that from four option, two option, or they know that two option is not its answer, like they can eliminate two option, they can eliminate, but in two option they have confusion, so that type of question you can see lot of questions 30 to 14, you can see that type of questions, 30 to 40. So your next aim is to make that 30 to 40 medium tough question correct. If you use this elimination method, you can make at least 25, uh, questions correct. At least 25 question correct. If 40 question was there medium tough, 40 question was there medium tough questions, and you used the elimination method, and by doing this elimination method, if you answer majority people, at least 25 question will be correct. So how much mark you will get? You will get 25 mark. Already you got 40 or 30 or 40 mark. Now you are getting 65 mark. How many question? 100 question you got 65. 65%. Now you got 65%. So you can you can hope for the job. But I know that many of you cannot answer these 30 40 easy question you will not get, or 30 to 40 medium question you will not get. To get that thing, I'm telling, prepare, study. In any exam, if you go in any exam, 20 maybe 20 to 10 to 20, depends, okay, maybe 30, okay, 20 questions, 20 questions will be very tough. 20 question means in 100 question 20 questions will be very very tough. To answer that thing you need preparation for 1 year, 2 year, 3 year. You have to be expert, to answer that thing. But we don't have time to become expert. So that is why we are telling, do the preparation in this manner. If you do the preparation in this manner, you can get at least 65%. Okay, so the answer is upper thigh. So from today onwards, when you attend any exam, that is why we are telling practice. If you are taking book and study, I know a lot of people are studying questions from the books. It is good, but you need practice. Without practice, if you go and directly attending exam, what will happen? You cannot follow these things. When you attend exam, first what you have to do, you will read the question, no? Easily you have to read the question. So from the question itself, you attend first question. If you know that this is easy or medium tough question or something like that. If you see it easy question, answer that. Then go for the complete. First you complete the easy question. Read the question. If it is easy, answer. Then go the next. If it is medium or it is very tough, don't answer now. Then within that, for that I'm telling practice. Okay, suppose within 1 hour, or within 40 minutes, you have 3 hour exam. So within 1 hour you finish the easy questions. Then you come and attend the medium tough questions. In medium tough questions, you know that 4 option, 2, 3, 4 option. If you can eliminate 2 option, you know that these 2 option will not be answer. So you have only 2 option. From this option, whatever your mind is telling, take it, put it. Okay, then go for the next medium tough question. After that, check how many questions you have answered. If from 100 question, if you answered 30 or 40 easy question, and if you answered 30 to 40 medium tough question, then don't go for the very tough question. Means you don't have any idea about that question. Don't go for the very tough question. Leave that question and come. See, the condition is that you should have answered at least 80 question. If there is 100 question, at least 80 question. If there is 200 question, at least 160 question. In that, at least 80 question should be easy question, and rest of the 80 questions should be medium type. In that situation only, if your condition is not like that, if you feel all the questions are very tough or majority of the questions are very tough question, then attend it. There is no other chance for us. So take risk, attend it. And attend it and go for study. Start your study from the next day itself. But I am telling, if you're doing preparation, you can answer. If you answer like this, there is chance for you. There is chance for you. Don't get worried. Okay, I am not able to answer this thing. Don't think like that. There is chance for you. Okay. Next question. The nurse is to administer an iron injection to an adult. How should this be administered? So we are going to administer iron injection. So how should this be administered? Okay. So first option. 1 minute. 1 minute. Because some people they are attending class. I think Rahul is attending class from the website, and some people are attending from the YouTube. And this YouTube link, other people will not get. Only you will get the link. Okay, it is a private link only. Okay. So this question, easy question. Iron injection. Iron injection. Iron injection. We are giving iron injection. Iron injection. How should this be administered? How should this be administered? Subcutaneous in the arm, intradermal in the forearm, IM in the deltoid, Z tract in the IM in the gluteus. So the answer is, we will give the iron injection in the as a IM injection, intramuscular in gluteus, where we will give gluteus. Gluteus we will give. So 3 point I am telling, we will give it as IM. We will give it in the gluteus muscle. Then we will give as a Z tract. Z tract. Okay, what is the Z tract? What is the Z tract? Z tract means when you give injection. Z tract means when you give injection, you will pull the muscles. You will pull the muscles to the lateral side. You will press on the muscles to the lateral side. That is Z tract. Just go in the Google and check for this image Z tract, how it is doing. Just we are stretching the muscle. We are stretching the muscle. That is Z tract. Okay, why we are doing like this? Why we give Z tract? When you give iron, why we are doing like this? Z tract. Why we are doing? Okay, to avoid leakage. To avoid leakage. What will happen if there is leakage? Okay, to avoid leakage, because if there is leakage, this iron is a painful injection. So if there is leakage, it will irritate subcutaneous tissue. Okay, to avoid leakage, or to seal the injection. To seal the injection means to trap the injection there, otherwise it will leak. To seal the injection or to avoid leakage, to avoid irritation, all those things we are doing this Z tract. To reduce pain, to avoid leakage, to seal the medicine, to seal the injection, all those things you can say. Why we are doing this thing? Okay. Bag and mask ventilation. Bag and mask ventilation is contraindicated in newborn resuscitation with the clinical suspicion of. In which condition in newborn you will not give bag and mask ventilation? Which condition? In diaphragmatic hernia, in intracranial hemorrhage, in meconium ileus, in pneumothorax. Okay, so four condition I have given. So first what I will do, I have confusion. Bag valve mask ventilation, I have some idea. So I know that, okay, in meconium ileus, there is no problem. There is no problem in giving bag mask ventilation. In intracranial hemorrhage also no problem giving bag valve mask, bag mask ventilation. But I have doubt now in diaphragmatic hernia and pneumothorax. So now in front of me only two options, because by using my knowledge, my experience, I know that intracranial hemorrhage will not be the answer. Intracranial intracranial hemorrhage will not be the answer, and meconium ileus will not be the answer. Now I have only two options. From this option, I will select anything. As a student, if I am sitting for the exam, I will select any one of these, any one of these. So that is what I told elimination method. Okay, now we will see the correct answer. The correct answer is diaphragmatic hernia. If there is congenital diaphragmatic hernia, or you suspect congenital diaphragmatic hernia, we cannot give bag mask ventilation. We cannot give bag mask ventilation because already the patient hernia, the stomach, all those things are distended. So if you give bag mask ventilation again, the stomach will distend again, and it will cause damage to the lungs also. There will be damage to the lungs also. So in that case, we will not give diaphragmatic hernia. We will not give bag mask ventilation in newborn resuscitation in diaphragmatic hernia, congenital diaphragmatic hernia. Indwelling catheter is inserted into the bladder in severely burned client. The major purpose is, so in burn patient, severely burned patient, if there is a 25% and more burn, we can call it as a severe burn. So in severe burn patient, we will introduce, or catheter will be inserted. Why? The major purpose: maintain the bladder tonicity, measure the available urine output, prevent UTI, prevent contamination of burned area. So by using my knowledge, I know that maintain bladder tonicity, no, severely burned client. So now the bladder tonicity maintaining, it's not important. So this will not be the answer. Then I will go and prevent UTI. Prevent UTI. I will tell, okay, UTI severe burn area, it is not an important one. So I will tell not prevent UTI. Now I have doubt, measure the hourly urine output and prevent contamination of the burned area. From this, I will select anything. Like this, you have to attend the exam. Okay, like this, you have to attend the exam if you don't know the correct answer. If you don't know the correct answer. Why I eliminated these two? Because I have some knowledge. If you have some knowledge, then only. If you don't know anything regarding this, then also you don't tell that, again, this will not be the answer, this will not be the answer. Like, not like that. By using your knowledge, existing knowledge, experience, if you can eliminate, then eliminate. Okay. Now the answer for this one will be measure the hourly urine output. Why? In severe burn patient, you have to check the urine output. The best and common non-invasive method common non-invasive method to assess the tissue perfusion is, in burn patient, is checking urine output. By using urine output, in burn patient, you can check the tissue perfusion. The best method, tissue or commonly used method, tissue perfusion. Okay, so measure the urine hourly. So what should be the normal one? or you have to maintain the urine output between 30 to 50 ml per hour. 30 to 50 ml per hour. 30 to 50 ml per hour. In burn patient, you have to maintain the urine output between 30 to 50 ml per hour. Clinical thermometer was invented by Edward Jenner, Ronald Ross, Alexander Fleming, Thomas Albert. Thomas Clifford Albert. Clinical thermometer. Those people who are attending class in the website, better if you can, I have sent the link, if you can come in the YouTube link, so that you can comment more, because when in the website, if you ask doubt or if you comment, I cannot handle both the things. So if you can attend the class first in the YouTube link, then if you want to see the recorded class, you can watch in the website. No problem. So clinical thermometer was invented by Thomas Albert. ALLBUT. Thomas Clifford Albert. Okay. So this is the answer. Thomas Albert. ALLBUT. Thomas Albert. Now itself we will study clinical thermometer Thomas Albert. Clinical thermometer Thomas Albert. All of the following are side effects of blood transfusion except. See, this type of question you have to read properly. All of the following are side effects of blood transfusion except. So among these four, one is not the side effect. What will be that? One is not the side effect. Hypocalcemia, hypothermia, acidosis, hypercalcemia. What will be the answer? The answer is hypercalcemia. Why? See, in blood transfusion, you know that citrate is there in blood transfusion. When you store the blood, there is citrate. Citrate is there. And this citrate, when you transfer or transfuse blood to patient, this citrate will join with the calcium. So this citrate will join with the calcium, also magnesium. Okay, so the citrate present in the blood, from where this citrate is coming, before doing blood transfusion, when you store the blood, you are adding citrate as an anticoagulant, and this citrate will combine with calcium, combine with the magnesium. So what will happen? There will be hypocalcemia. Hypocalcemia will be there. There will be hypomagnesemia. Okay, hypocalcemia will be there. Hypomagnesemia will be there. Then yesterday we told that there will be acidosis. Acidosis will be there because citrate in the citrate in the blood, it will cause acidity. So acidosis will be there. Metabolic acidosis will be there. So hypocalcemia will be there. Hypothermia will be there. Acidosis will be there. Hypothermia means, after blood transfusion, some people will get a chill, see all those things. No? Hypothermia will be there, but hypercalcemia will not be there. So the answer is except. All the following are side effect except hypercalcemia. calcemia, hypercalcemia, because hypocalcemia will be there. Next, sometime you will get questions like this. Okay, you get questions like this and you don't have any idea, zero idea you have this about these questions, zero idea. So in majority questions, if you have zero idea and you cannot eliminate, you have zero idea and you don't know how to eliminate any of these options, but you know that one here, see this option, hypocalcemia, this option, and this hypercalcemia, these are opposite options, hypo and hyper. So you can, like, you can assume that maybe answer hypo or hyper. Now you don't have any idea, zero idea, and you are not able to eliminate any of the option, but you saw that in these four options, two option is opposite. One is hypo and one is hyper. Example like this. One is hypocalcemia and one is hypercalcemia. So you can use some tricks that, okay, maybe you can assume, okay, if your situation is like that, you are not able to answer most of the question, you are in a bad situation in the exam, so somehow you have to get some mark. So what you have to do, you can check that, okay, hypo or hyper, any of these are correct. So then you select hypo or hyper, anything you like, you select it. Maybe it will, there is chance, 50% chance for becoming correct. If it is 50% correct, you will get 1 mark. 1 mark. Sometime because of that 1 mark, you may get selection. Condition I applied, I told the condition. If your situation is bad situation, you are not able to answer anything. So in that situation, and the question is coming like this, opposite action, opposite option is giving, like this only give. Okay. So hypercalcemia. Then which of the following which of the separating this change hear Hello, hello, hello. Can you hear me? Hello, hello, hello. I think you can hear me. I think you can hear me. Hello. Okay, now I think you can hear me. Okay, some problem was there. I don't know what happened. So technical. No, sometimes it happens. Technical, no. Okay, we'll start now again. So I already told you the answer. Firm mobile node. So the answer is firm mobile node. Okay. Which of the following helps to identify flail chest in a patient with chest trauma? Which of the following helps to identify flail chest in a patient with chest trauma? So in chest trauma, if you see chest trauma, just remember paradoxical chest movement. Paradoxical chest movement. Paradoxical chest movement. Okay. I'm going fast because now we have only 30 minutes and we have to cover some more things. So I will go on a fast mode. Okay. Multiple rib fracture is seen in X-ray. You cannot tell that this is a flail chest. Okay. For flail chest means what? Flail chest. Flail chest means that in flail chest you can see paradoxical chest movement. Paradoxical chest movement means suppose this is the chest and there is ribs. There is ribs. So you know that when someone breathe, when they breathe, their chest will expand. When they breathe out, chest will decrease. The chest size will decrease. Okay, it will expand and decrease. That is the normal thing. When someone breathe, chest will expand and go back to normal. Okay, but here what will happen when if there is here one fracture is there, these three fracture, here fracture is there, which means that when you breathe, all these part will expand, but this part will go inside, and when you breathe out, all this part will go backside, but that time this part will come out or expand. Um, that is called you know paradoxical chest movement. That is called paradoxical chest movement. Okay, so in flail chest, paradoxical chest movement, tracheal deviation. Tracheal deviation we can see in which one? Pneumothorax and all. You can give cardiopulmonale, all those things you can see tracheal deviation. But in flail chest, paradoxical chest movement. Then, which of the following is an absolute contraindication for the use of fibrinolytic therapy? Which of the following is an absolute contraindication? Absolute contraindication. So sometime when you see these questions, you may think, okay, contraindication, fibrinolytic therapy. Suddenly you will see use of anticoagulant. You will think this is the answer because suddenly we don't have time, and like that in exam hall when you are sitting, you don't have time. So suddenly you will see this one, you will mark it, but that is not the answer. because this is a anticoagulant, this is a contraindication. Okay, contraindication. And peptic ulcer disease also contraindication. Okay, but here they asked you absolute contraindication, so the answer is suspected aortic dissection, see, fibrinolytic therapy means fibrinolytic therapy. In fibrinolytic therapy, what there is two type of contraindication: relative and absolute. Okay, in relative is like a peptic ulcer. If a patient is having peptic ulcer, or use of anticoagulant, okay, all those things are relative. But in absolute, if you see, that is any intracranial hemorrhage or major surgery, not minor surgery, major surgery, and any cardiovascular lesion, or bleeding, major surgery, intracranial hemorrhage, all these are absolute contraindication. But peptic ulcer disease, anticoagulant, all these are relative. Contraindication. Important. Next, I will discuss some because our time will finish now. Before that, we will discuss some points, some important points. Types of solution. Okay, one is types of solution. Different solutions are there. The IV fluid. I'm talking about the IV fluid. Types of solution. Actually, there are three types of solution. Three types. Okay. The first one is crystalloid. Three types of solution. The first one is crystalloid. Okay. In crystalloid, sorry, there are types of solution. There are two types of solution. And the first one is crystalloid. I'm talking about crystalloid. In crystalloid, there is three type. Crystalloid itself, three type. Okay, what is that? Isotonic, hypotonic, and hypertonic. Okay, so in type of solution, first one is crystalloid. Crystalloid itself, there are three type. One is isotonic, then hypotonic, and hypertonic. Okay. Isotonic means what? Isotonic means, see, suppose this is your cell, and this is your one vein. Simply one vein and one cell. It is not like this. For understanding, I'm telling. One vein, this is a vein, and this is a cell. Okay, so you are giving one fluid from here. You are giving IV fluid. Okay, suppose if the concentration of this fluid, so you are giving one fluid. Okay, one IV fluid by IV line you are giving. So this is, what is this? This is your vein. Inside vein, blood is flowing and fluid, all those things. And here, what is that here? Here cell is there. I'm just drawing one cell. Not, it is not like that, but I'm telling for your understanding. One cell is there. Okay. So that fluid, this fluid concentration, this fluid is coming here. So now the fluid is here. So if the fluid, this fluid concentration, and already inside cell there is some fluid. No, inside cell there will be fluid, and this concentration and this concentration both are same means iso. So this is what is we called isotonic. So if the concentration intracellular, inside cell and outside cell are same, then we will call it as isotonic solution. Example, 0.9% NS, 0.9%, not NS, 0.9% NS. They may ask you example, 0.9% NS. Okay, then RL, Ringer lactate, RL solution, RL. So 0.9%, then RL, then 5% dextrose in water, D5W, 5% dextrose in water, 0.9% NS, 5% RL, then 5% dextrose in water. All these things are isotonic. And you will give when there is fluid deficit, bleeding, diarrhea. Fluid deficit, bleeding, diarrhea. Because in diarrhea, what is happening? Initially in diarrhea, from your extracellular, from your blood vessel, extracellular, from extracellular, the fluid is going. Okay, in bleeding also, bleeding blood is going from your blood vessel. So you have to fill that thing. So what you have to do? You have to give isotonic solution. Bleeding, diarrhea, fluid volume deficit. You can give initially what? Isotonic. So remember all normal or all the fluids which you are using normally, normal saline, 0.9% normal saline, RL, normal RL, all these are isotonic. Remember, every day you are giving this fluid. Every day you are giving this fluid to patient. Remember, they are isotonic. Fix in your mind. And you are giving for fluid volume deficit, bleeding, diarrhea, all this some of the example. Hyper, hypertonic cell. Hypertonic cell means this is a cell, and here it is intracellular, inside cell, and extracellular. You are giving some fluid, one fluid. Now what is happening means, now this concentration is more. This fluid concentration is more. What is the meaning of concentration is more means? What is the meaning? Suppose this is a fluid in that concentration. Suppose I'll tell you like salt is a glass of water, and if there is more salt means more salt water is there, then more salt means I will tell it is a concentrated, too much concentrated. Same way, too much concentrated. Same way, this fluid which I am giving, it is that much concentrated, too much concentrated. Compared to here also some fluid is there, and here I have given some fluid. Here I am giving some fluid. Already inside my cell there are some fluid. But compared to here concentration is more concentration, more concentration. So always my body, what they will do to do balance. Always body, what they will do? They will do balance. Body, what they will do? They want to make it balance. Here and here, both should be same balance. Both should be same balance. They have to do balance. So how we will do balance? Suppose here one glass of water is there, here one glass of water. Okay, here the concentration salt is more salt is there, and water also there. Here less salt, here less salt. So here more concentrated, and here less salt, and here more salt. So I want to make it balance. To make it balance, what I will do? To make it balance, what I will do? From less salt area means here too much water is there, no? Less salt, here more salt. So if I put some water here, what will happen? These two will become balanced. I can put salt from here to here, but salt I cannot move. I can move only water in this situation. So what I will do? From this glass I will put some water in this glass. So here there was more salt, but I put more water from here. Now these two became balanced. Same way here, concentration, here more concentration means more salt. Here less salt inside cell. So what I will do? I can put water from here. I will take water will go from here, to my extracellular area. Okay, so what will happen? This cell will become small, shrink. Okay, so in hypertonic cell, what is happening? My cell will become shrink, because from my cell, inside cell, water will go outside cell, because outside cell too much salt is there. to reduce that salt, to reduce that concentration from inside my cell, water will go there. Water will go there. So it will become, I can, what I can do, I can reduce. I can, that thing I can reduce. Okay. So that is called hypertonic shrink cell. Example 3% ns, 3% ns. Symbol. Yes, before I told you, sorry, before I told you 0.9% ns is isotonic, no? Isotonic. So here 0.9% is isotonic, means 3% means more, no? 3% more. So it means it is hyper. It means it is hyper. 0.9% is normal. So 3% is hyper. Okay. So then 5%. 5% is also hyper. 10%. Before I told dextrose 5% is a normal. So 10% dextrose is hyper. Okay. Dextrose 5% is normal. So dextrose 10% is hyper. 0.9% is normal. Then 3%, 5% NS all will be hyper. Okay. And in cerebral edema, okay, where you will use this in cerebral edema. In cerebral edema, you can use. I'll give you one example. Suppose, okay, just look at the picture only. Don't read here. Look at the picture. In cerebral edema means the cell are big. The cell are big. I want to make this cell small, shrink this cell, because in cerebral edema, a lot of edema is there in my cell. So I want to make it small. So what I will do, I will give hypertonic. I will give hypertonic. Then this cell, from this cell, fluid will go outside and this cell become normal, small. Okay, so hypertonic solution you can give in cerebral edema. Hypo means opposite. Hypotonic solution. Hypotonic solution means, see, suppose this is one cell. I'm giving I'm giving this solution which is hypertonic, hypotonic. Concentration is less. Here concentration is less. So compared to this, concentration less here. Here what is the concentration? More concentration. More concentration is here, because I give hypotonic, less concentration fluid. So compared to this, here inside the cell the concentration is more. So what will happen? Fluid or water will go from here to here. So what will happen? This cell will become big. Okay, so if you give hypotonic solution, what will happen? Cell will swell. Example 0.45% NS, 0.33% NS, because 0.9% is normal. So 0.33% or 0.45% they are hypotonic. Okay, in intracellular dehydration you can give, and never give hypotonic solution in cerebral edema or in burn. In burns, in cerebral edema, don't give hypo solution, because again the cell will become big. Then next type is colloid. Crystalloid I discussed. Next is colloid. Colloid means it contains large molecules, and do not pass cell membrane. You just remember only this thing. Example: dextran, albumin, mannitol. They are colloid. Dextran, albumin, mannitol. They are colloids. Okay, mannitol, albumin, dextran. They are colloids. Next, tracheostomy suction. Tracheostomy suction means okay. Tracheostomy suction position. I will go on fast because we don't have the time. So when you do tracheostomy or tracheostomy suction, you have to place the patient in which position? Semi-Fowler or Fowler's position. Spelling is wrong here. Semi-Fowler's or Fowler's position. Then hyperventilate the patient before tracheostomy suction. Hyperventilate the suction. You all know this thing because you are always doing. And not more than 10 seconds. When you do the suction, not more than 10 seconds. Not more than. In some books, it is saying 15 seconds. Not more than 15 seconds. but ideally 10 seconds, not more than 10 seconds. Then when you do suction, do in a rotatory manner. The catheter, the tube should be moved in a rotatory manner. Then pressure of suction. Yesterday we told about nasogastric suction. Now I am talking about tracheostomy suction. So the pressure means 100 to 120, which was same for NG or NG tube suction also. 100 to 120 for the adult. Children 95 to 110. Infants 50. Infants 50. Double for the children means 110, around 110. Then adult 100 to 120. Okay. Second or third tracheal ring is used for tracheostomy, where you will make the tracheostomy incision. This is the neck. Okay, this is the neck. So where you will make second and third tracheal ring. You will use second and third tracheal ring for the tracheostomy incision. Then when you do suction, there should be 20 to 30 seconds. Okay, now you are doing suction. After 20 to 30 seconds only, you have to do the another suction. Don't do suction continuously. Do suction, then a gap. Gap means 20 to 30 second gap. Okay. So suction I discussed. Next, chest tube drainage system or intercostal drainage, ICD, and or chest tube drainage system. So why we do this is very important. Why we do means, for removing excess air or fluid. If in the pleural space, if there is excess fluid or air is there, to remove that thing, we are using this intercostal drainage system. Means we will insert the tube, we will insert the chest tube into the pleural space and we will remove it. So when you put the chest tube, we will create a negative pressure. We will create a negative pressure in the pleural space. Then only you can breathe normally. Otherwise, you cannot. If there is fluid or air inside your pleural space, then you cannot create negative pressure. There will not be negative pressure in the pleural space. Then you cannot breathe normally. So to create negative pressure, what we will do? We will remove the excess air and fluid so that you can create a negative pressure inside the pleural space so patient can breathe normally. Okay. So chest drainage system means we will insert one tube into chest. Okay, into the chest thoracic cavity we will put one tube, and the tube, the chest, there will be one tube. Okay, like one tube will be there, and it will go to, there will be three chamber will be there. Okay, three chamber will be there. So normal, there are 4 chamber, 2 chamber, 1 chamber, single chamber, different type of chest tube drainage system is there. But I am talking about three tube normal, 3 chamber chest tube drainage system. 3 chamber. First one is drainage chamber. So drainage chamber means simple. The fluid, air, fluid, or all those things will come and collected in the drainage. That is the drainage collection chamber. That is the first chamber, collection chamber. Okay. Hope you all know what is just the tube drainage system or intercostal drainage. Okay. So drainage collection chamber, that is the first chamber. Okay. Then second is water seal chamber. Another one is, I told you there is 3 chamber. 1, 2, 3. Okay. So from the patient chest, the tube is first coming to the drainage chamber. Then another one is water seal chamber. In water seal chamber there will be water. Okay, in water seal chamber there will be water, and the tube which coming into the water seal chamber will be inside the water, not outside, inside the water. Because this is inside the water, you can create negative pressure. So this tube will be inside. So this is the water seal chamber. Last chamber is suction chamber. So I told about this one. Now water seal chamber, we are discussing water seal chamber. So inside a water seal chamber there will be water. That is why we are telling water seal chamber. Okay, that is why we are telling water seal chamber. Always there will be a oscillating movement of the water. Always normal patient, whatever it is, there will be normal. It is a normal finding. If you are a normal person and I am putting a chest drainage tube, then in your tube also, in your system also, there will be a oscillating movement. It is a normal finding. When patient inhale and exhale, there will be oscillating movement. Don't worry, this is a normal finding. But excessive bubbling, suppose if you see excessive bubbling or continuous bubbling or excessive bubbling. Continuous bubbling or excessive bubbling means it is abnormal. Continuous bubbling or excessive bubbling means it is abnormal, which means that air leakage. Air leakage. You know that when there is more air leakage is there, when there is air leakage is there inside a water, there will be bubbling, no? So what is that? If there is extra means continuous or excessive bubbling means it is a abnormal finding. We have to think about air leakage. Intermittent bubbling. So I told about a continuous and excessive bubbling. Sometimes intermittent bubbling will be there. Intermittent means now there is bubble is coming, and after some time some bubble. No, this is called intermittent bubbling. Intermittent intermittent bubbling means actually it is a normal one. Okay, intermittent bubbling, if you are seeing, it is a normal one. Okay, especially in pneumothorax, in pneumothorax, when there is pneumothorax and you put chest drainage tube system and you are seeing intermittent bubbling, don't worry, it is a normal thing. There is pneumothorax, you put chest drainage system and there is continuous excessive bubbling, then it is a problem. Otherwise no problem. Intermittent bubbling, no problem. There will be a movement, oscillating movement, no problem. But suppose if there is no oscillating movement, suppose if there is no oscillating or fluctuating movement, then what is the reason? Sometime maybe the tube is obstructed, or kinked. Okay, kinked. Tube obstructed, kinked, or sometimes the lung has re-expanded. Lung has re-expanded. Maybe lung became okay. Lung has re-expanded. Okay. So when there is no absence or movement, what is your first action as a nurse? What is your first action? They will ask. You have to check the tube. You have to check the tube whether it is obstructed or kinked or something like that. Okay. Then suppose a question may come, if you can see excessive movement, you can see excessive, oscillating movement. As a nurse, what you will do? As a nurse, what you will do? Normal finding. Excessive bubbling is there, then only inform the doctor, physician. Then in the suction chamber, so third is suction chamber is there. Suction chamber. In the suction chamber, if you see suction chamber, there will be gentle bubbling. There will be gentle bubbling. Where? In the suction chamber. Don't worry. Gentle bubbling means in suction chamber I'm talking. I finished water seal drainage chamber, water seal chamber, then suction chamber, suction control chamber. There is gentle bubbling. Gentle bubbling means it means that suction is working. Okay, the gentle bubbling means suction is working. It is normal. Next, nurse's responsibility, nursing responsibility. Okay, suppose if the drainage amount, you are collecting the drainage. So if the drainage amount is more than 70 to 100 ml, more than 70 to 100 ml, more than 70 to 100 ml per hour, and also if it is a bright red, color is bright red. Okay, so 70 to 100 ml per hour. Then if the color is a bright red, inform the physician. 70 to 100 ml, and sometime per hour and sometimes suddenly more fluid are coming. Maybe in 1 hour when you check it is 70 to 100 only, but initially more fluid came, more suddenly 50 ml came suddenly, then also you have to inform. But normally in 1 hour 70 to 100, 70 to 100 only we need, 70 to 100 only we need. Okay, then if the chest tube is pulled out, what you will do? Chest tube is pulled out of the chest. Okay, so I told you that this is very important. So this is the patient. This is the patient. One tube is there and it is connected to the chamber. This is the drainage system. Okay, suppose tube is disconnecting from here. Tube is disconnected from here. So what you will do? If the chest it is disconnecting from here, means what you have to do? Means you have to do a occlusive sterile dressing. Apply an occlusive sterile dressing. Occlusive sterile dressing. Okay, or by using some petroleum jelly dressing. You can use petroleum jelly, Teflon dressing, or occlusive sterile dressing. From where the chest tube is pulled out, from the chest if it is disconnecting. Suppose this is the patient. This is the patient. Chest tube is there, and this is the drainage system. And tube is disconnected from here. From the chest tube, it is disconnected. Then what you will do? Then you will insert the tube into a bottle of sterile water. Okay, you have to insert the tube into a bottle of sterile water. You will insert the tube into sterile. So both are different action. Both are different action. You can clamp the tube. You can clamp the tube, then you can put into a sterile water, bottle of sterile water. So clamp first, then put the tube into a sterile water. Okay. Clamping, they are not in many books, they are not telling about the clamping. But in option, if there is clamping, okay, put that thing. Otherwise, put the tube into the sterile water bottle. Okay. Next, don't strip, milking or stripping. Do not milking or stripping of the tube. Never and never do that, milking and stripping of the tube. Then actually regarding clamping, I told you clamping, actually do not clamp the tube unless doctor is telling, or if you when you are shifting the patient you can clamp. Otherwise do not clamp the tube. If doctor is telling, then only you can clamp. And if the drainage system break or tube disconnected, that time also you can clamp. Okay, otherwise don't clamp, don't do the milking, don't do the stripping. And when you remove the chest tube from the patient, tell the patient to take a deep breath. Tell the patient to take a deep breath. So these are the things regarding chest tube drainage system. One more thing, this chest drainage system always work on the suction and gravity principle and the suction, all those things. Okay, next is where you will insert the, in pneumothorax and hemothorax, where you will insert the tube. Before it was told that second intercostal space, if it is pneumothorax, second intercostal space, if it is hemothorax, sixth intercostal space. Before they were using second and sixth. Now but it changed. Now we are using fifth intercostal space in the mid axillary line. Fifth intercostal space, very important. Fifth intercostal space in the mid axillary line. This is otherwise called as safe triangle. This is otherwise called as safe triangle. Fifth intercostal space in the mid axillary line. This is otherwise called as safe triangle. Safe triangle means safely you can insert the chest tube there. Chest triangle, safe triangle. Fifth intercostal space. Please remember. Okay. Then safe triangle. I will show you what is safe triangle. See, this area is called the safe triangle. This is the safe triangle. Question may ask in safe triangle, which how you draw the safe triangle. In safe triangle, one side in the anterior border, you can see latissimus dorsi, one muscle name latissimus dorsi, very important. In safe triangle, one muscle is one side you can see latissimus dorsi, then another side you can see pectoralis major, then one line superior to the nipple, one line superior to the nipple, then apex below the axilla, apex below the axilla. So see, here you can see this side means latissimus dorsi muscle, one side, and this side you can see pectoralis major, and here one line we will draw, that is above the nipple, above the horizontal line above the nipple. Then one is apex of the axilla, apex of the axilla. Okay, so this triangle is called as safe triangle. Safe triangle, very, very important. Before pneumothorax and hemothorax, different intercostal space we were using. Now it is fifth. Commonly we are using fifth intercostal space. These also you can use second and sixth, but safe triangle is this one. Muscle name, remember, latissimus dorsi pectoralis major. Okay, so we just finished okay. Okay, so now we finished our fundamental of nursing review. So next time, next what you have to do in the website. In the website, if you go to the website, you can see Aims model exams. Aims model exam 2. Remember, if you have time, then only attend. You will attend 10 question, 20 question, then you will leave. It will not work. Attend the full questions. After attending these full questions, tomorrow after 3 o'clock, I will publish the rank list. At the same time, I will publish the same exam, Aims model exam practice. In that, you can see the answer. So attend once again, so you can check your question and answer. Okay, for crash course students, today I have uploaded Aims model exam 2 and practice exam 2 day 2. Day 2 practice exam and Aims model exam for crash course students. You can attend both. For the regular students, I have uploaded last, if you check, you can see I have uploaded Aims model exam 2, and at the same time there are a lot of other exams available, fundamental of nursing, medical surgical, lot of exam. So that also you practice. From today onwards, we don't have time. We will study the important points, important thing, then we will practice questions. There is no other way for us. We will practice questions. First we will attend the exam, and again we will attend the same exam after checking, after after reading the reading the answer or correcting the answer. This is the only way. From these 10 days, coming 10 days, reduce your sleep. I know you have duty, all those things. Reduce your sleep. Try or work hard more, so that you will get the exam. Okay, use some tips, all those things. Definitely you will get, definitely. Our aim, I told you, to get 60% mark or 60% mark or 70% mark, 60% mark. So we have to, definitely we have to answer the the easy questions. Definitely have to answer the easy questions, then the medium tough questions. Okay, so fundamental of nursing we finish. Tomorrow, coming 3 days, we will discuss medical surgical nursing, like different topics. According to the questions, we will discuss the topics. So go and do your practice, exam practice. Okay, thank you very much for attending Aims, for attending in the I mean. Uh, in the website for attending. I'm telling again, please remember, those people who attended my class, direct class, crash course, for that people, I have given free. Free means they were in another website. Then I created a new website, new platform we started. In that new platform, I have given free access for you because you were already our member. So for the online people, regular people, whatever is coming, we will give. Whatever new we are adding, you will get all the things freely because you already paid. You already paid. Okay. Second is that, so those people who still now didn't, you are my old student, but you still didn't uh, created or sign up in the new website. What you have to do? I have sent you the website name. What you have to do? Go and do sign up and message me, old student. Okay, those people already did sign up, and all those people who are doing practice means continue that thing. Those people who never did that thing, that for that people I'm telling. And you did sign up, you paid, you did sign up. Next time, what you have to do? Next time when you open the website, remember when you open the website, always use my link because when you type www, all those things may not be go correctly to the website. So what you have to do, Nirmala, I will send you the link in WhatsApp. In the group I have sent many times. I will send you in the WhatsApp because if you type in the Google, you will not get properly because for a website there is SEO, a lot of things we have to do. So newly started website will take time. So you just click on the link which I always click on the link which I am giving you. Then you will go to that website. And if your username and password given to any other people, same time if you are opening in one mobile and one another mobile or another laptop, automatically it will be disconnected. So don't do that. If you have given to anyone, tell them don't use that. Your username password only for you. So when you open the website, first what you have to do, you have to log in the website. Okay, if you want, I can show you. If you want, I can show you. Swati Raj, Nirmala, see, lot of maybe 3 to 4 months ago, I was telling before exam, you people are doing these things. Before exams, now you are checking. Why I am not replying you means I am very busy here. I don't have the time. That's why I'm replying because I am always getting the Manisha Panigrahi. It is not a new website. You just now, you maybe 3 4 days ago, you just joined that thing, the same website only. I'm not talking about a new website. Same website only. You paid, you created your username, you are inside. Lot of people paid, after that they are not using. I will show you how to use that thing in my laptop. In mobile it is different because always people are asking me how to do that thing. So simple, what you have to do, I will show you. I will send you the link. When I send you the link, just click on that link. Okay, so when you click on that link, wait 1 minute, I will show you. Nirmala, no problem, but study from today onwards. Maybe you are studying from books, all those things, no problem. Like you can study from anywhere, no problem. Like study anywhere means books or lot of things. But why what I was telling means last time you were asking. That's why I told. Okay, no worry, no problem. I will send you after some time. I will send you after this class. I will send you. Okay. See, when you click on the on if it is your mobile, okay, if it is on your mobile, when you click, the page will come not like this, in a different manner, but in that page, what you have to do, you have to not go to course first. You see on the right side corner, right side corner, in the mobile you can see 3 to 4 line. Now I am opening in the mobile. It is in the mobile, sorry, in the laptop, so you cannot see that thing. In the mobile it is different. In the mobile you can see 3 to 4 line. Click there. When you click, they will tell you to wait 1 minute. Okay, in the website itself, when you click there, there will be option for the login option will come. So 3 4 line will be there. When you click there, what will happen? There will be option for the login. Those people already made sign up registration. Normally, I think you didn't do the sign up, so you have to do the sign up first, not login first. Sign up first. Sign up means by using your new password, new email ID, new password. For those people who did already, what they have to do, just put your username, then password. Okay, then do the login. After login, again you go to the right side. Again you go to the right side. In mobile also you go to the right side. You can see 3 to 4 line there. Click there. Then you can see options like, click there. Then you can see options like dashboard, course, blog, all those things. Okay. So if you want, you can click on the dashboard. When you click on the dashboard, what will happen? You can see the option like laptop. So it on the course. When you click on the course, you can see courses. So click which course you paid. If you paid the course for a regular course, click that. Means 1,800 rupees course. If you click purchase a 500 rupees course, means click on the 500 rupees course. Suppose if it is 500 rupees course, means when you click, it will come like that. You will see 500 rupees, all those things. But there is continue button. So if you paid already, then you can see this continue button. Click on the continue button. When you click on the continue button, again you can see like this. Sometime it will come like this, sometime it will come like this. Okay, so what you have to do, you have to continue course. Click on the continue course. Sometime what will happen in mobile, when you are opening this continue course, see the green color, it may be backside of this, backside only you can see one piece of this green color. So just click on the continue course. Some people, what they are doing, when they see this thing, they are clicking here. It will not it work. You have to continue course. You have to click on the continue course. When you click on the continue course, then it will be open. Okay, then it will be open. See, so now the live class, this was the live class. I will put to another live class. Live class you can watch in your mobile itself, in the website itself. Okay, live class you can see. You can see model exam, you can see practice exam, all those things you can see. Okay, so simple login. After that, select your course. Don't select your course first. When you select course first, then it will ask money. You log in. If you paid already, log in, then select the course. Okay, so today's class सुना नहीं दे रहा है sir. Maybe some problem. Now maybe you can hear. Manisha, just go and practice. If you have any doubt, just send me message. I will send you the website. In group, I have added you to group. I have added you to broadcasting group. Please save my number, so always you will get my notifications, everything. And in group also, please, I have added 2 3. We have 3 to 4 study group is there. In that study group also, uh, In the study group also you can see the details. Whenever new class is there, today also I put a message that class will be at 6:30 p.m. You can get it on the link, this one, or you can watch it on the website I mentioned. So please study well, and we have 10 days more. Okay, thank you very much.